Staffing Ratios Based on Acuity by Kayla Christensen, Angela De Herrera, Shauna Priest, Mirtha Ramirez, Vanessa Vagliente, and Krista Zimmerman. California State University San Marcos, School of Nursing, Nursing Leadership and Professional Issues, Nurse 450 with Dr. Fidelow. Introduction, nurse staffing ratios. Nurses have long argued the need for adequate staffing to provide safe and effective patient care. But it hasn't been until recent times that research studies, policies, and legislation have been implemented in support of this idea. According to the American Nurses Association, or the ANA, there are several factors that can influence staffing ratios within a healthcare organization. Some of these include the complexity of patient care, the acuity or intensity of nursing care required for a patient, how stable a patient's condition is, how often admissions, discharges, or transfers occur on a unit, the education, experience, and skill level of both nursing and supportive staff, as well as the availability of resources. Recent studies have shown increased patient outcomes, financial incentives, and reduction in staff turnover with adequate staffing ratios. Some of the benefits of adequate staffing ratios based on patient acuity will be discussed in this project, and it include the reduction of medication errors, decreased patient mortality, decreased hospital readmissions, decreased length of patient stay, reduction of preventable events such as falls, pressure ulcers, central line infections, and healthcare-associated infections, or HAIs, as well as better rates of staff retention due to increased safety, lower levels of fatigue, and higher job satisfaction. Federal staffing laws and regulations. Federal nurse staffing laws and regulations have long been lobbied for by various different stakeholders. Current federal regulation is limited to Medicare participants and has sparked numerous states to adopt their own legislation to address nursing ratios. Current federal regulation under Section 482.23b of the Conditions of Participation for Nursing Services states that, quote, nursing services must have adequate numbers of licensed registered nurses, licensed practical nurses, and other personnel to provide nursing care to all patients as needed, end quote. Current national legislation introduced under the 114th Congress include an ANA-endorsed bill, the Registered Nurse Safe Staffing Act of 2015, as well as the National Nurse Shortage Reform and Patient Advocacy Act, and the Safe Nurse Staffing for Patient Safety and Quality Care Act. The Registered Nurse Safe Staffing Act of 2015 was introduced to the Senate by Oregon Congressman Jeff Merkley in April 2015, and would require a plan to have, quote, appropriate number of registered nurses to provide direct patient care in each unit and on each shift of the hospital to ensure staffing levels that, one, address the unique characteristics of the patient and hospital units, and two, result in the delivery of safe, quality patient care consistent with specific requirements, end quote. The National Nursing Shortage Reform and Patient Advocacy Act was introduced to the United States Senate by California Congresswoman Barbara Boxer. This act calls for acute care facilities to provide acuity-based registered nurse staffing ratios, provided minimum ratios are met at all times. The Safe Nurse Staffing for Patient Safety and Quality Care Act was introduced to the House of Representatives in March 2015 by Illinois Congresswoman Janice D. Schakowsky and would require hospitals to set and implement minimum nurse staffing ratios to the U.S. Department of Health and Human Services. State regulations. There are currently 14 states with regulatory nurse staffing minimums, which are depicted on the map on this slide. In California, Assembly Bill 394 was passed in 1999, which mandated the State Department of Health Services to establish specific regulatory minimums for nurse-to-patient ratios by license classification and specific licensed unit. This bill was the first of its kind and has modeled some of the language of the National Nurse Shortage Reform and Patient Advocacy Act, which I just mentioned, which was introduced by Barbara Boxer. Final regulations on AB 394 were issued in 2003 with amendments to the minimum ratios, which are to be met at all times, which are also listed on this slide. After a literature review and group discussion, we have taken a position that is supportive of the ANA's stance on staffing. To provide high-quality, cost-effective care, we support the ANA stance of staffing and propose hospital policy incorporate acuity-based staffing ratios in order to reduce medication errors, decrease patient mortality, readmissions, and decrease length of patient stay, reduce the occurrence of preventable adverse effects, and maintain job satisfaction and staff retention. The purpose of this project is to investigate the professional issue of nurse staffing ratios based on patient acuity and to support our position on this topic with evidence-based practice.